Matthew Holt, I haven't talked to you in 12 hours, and yet in that 12 hours, you have managed to start not one, not two, but 3 different tweet streams about the completely irreverent on Twitter. The first one was about telehealth and the Russian doll of what's going on there, which just kicked that shitstorm into action. Then you followed that up with the, I'm going to call every bank in America and wait on hold while I also tweet them and see who answers first. And then my favorite was the PPP scandal you tried to start on Twitter, which really wasn't about PPP at all, but about DPP and Livongo's diabetes prevention study, which you messed up. And thank God Brian Dolan was there to call you out. I hope everybody is settled in to hear more about the exciting life of Twitter sensation at Multipoint on this episode, the July 29th episode of Health in 2.00.
I have no idea how you got through.
What are you doing over there? I feel like this quarantine has hits you really hard because your self-quarantainment is just, I don't know anymore. Like,
But Jess, hasn't it given you the idea for a new game show?
yeah. And Kim Ballard agreed with me that this should be a show, Holt on Hold. And we're going to turn it into a gambling show. So we're going to put you on the phone with a Zoom camera on you watching. You call in to the bank of your choice. We wait on hold with you, watch you harass the customer service people on Twitter, and we place bets on how high your blood pressure goes while you're waiting on hold. And then there's going to be this thing called the Holt Value Index. And when you're done, after hearing how valuable your call was, you're going to just announce a number on the value index of how valuable you feel your call really was. And then we're going to collect money on that too.
Important to you.
I miss sports. So this is good.
We have a sponsor lined up.
For that, Withings, they just raised a whole bunch of money. So why not throw it at this with your little wireless blood pressure cuff, your wireless scale back there?
You ready?
I'm ready. Let's do it. We're going to start it off with Withings because apparently they should have collected a royalty on that wireless scale picture on everybody's IoT slide in startup world. Instead, they didn't. They got 60 million in a new round. What is going on here? This money has been a long time coming.
Well, not really, because they sold the whole company for like 170 million or 180 million to Nokia like 3 years ago. And then it was a short sale. It was like what we should do with Tesla. Then they bought it back, and now they're getting funded again for the same stuff. So the little insider thing is that I know someone who tried to get some thermometers out of them, a mass production of thermometers, and they're all sold out because of COVID. So thermometers, they have the weight scale, they have the blood pressure cuff, they have the fancy watch, and they're kind of trying to do more medical grade stuff. But yeah, the IoT is back. It came, it went. So the Fitbit's getting bought by Google.
Yeah.
They're around, and I'm sure Nokia will buy them back in a few more years.
There we go. All right, what about Neurovalence? Speaking of adding things, they've got a headset that's supposed to help with obesity, and then they're trying to get approval for it for insomnia, diabetes, a bunch of stuff. They raised 5.5 million euros.
Yeah, this is sort of mixed California and Northern Irish company, and really it's all about trying to use the tool, these sort of new sets of tools. It's another way. It's like neurotesting and the game stuff to try to get around drugs for the same types of conditions. We've seen a bunch of these kind of things, like trying to alter your head and change your perspective and do whatever. And this is just another one.
All right, Pocket Health raises 6.5 million. We missed this one back in April, but we know how they've spent at least $1 million of that hiring ePatient Dave. What is going on here?
Just $1 million? Surely you asked for more than that. It's a way for sharing images, which is part of the medical record. It's hard to get for patients to be able to get access to their images, and they've hired a guy who's had a very famous lung X-ray as their spokesman, chief patient officer, whatever, and he's leading the way for all us angry Twitter people.
All right, we teased this yesterday. Sidecar Health gets 20 million. This is a price transparency, direct pay kind of thing.
Yeah, it's also a short-term health. It's an insurance plan as well. And I think, they're trying to say we give you an insurance plan you can then go to any doctor, but we've pre-negotiated a cash rate, and we'll give you an app to figure that out and a card. The basic problem underlying this is that, yeah, cash rates may work, and they may be cheaper than a typical PPO. And you've seen a lot of this stuff in pharmacy cards. A lot of attempts to do something similar, kind of back in the old days, before GoodRx kind of bundle them all together. The problem is that if under the ACA, they're currently allowed just because of a Trump administration ruling, and that will get reversed as soon as Biden comes back in. So it's a very risky play, I think, for the companies invested in these guys, because they're going to have to really pivot around if the short-term insurance plan gets banned. Short-term insurance plans get banned by Biden, which they should be, because they're a very bad public policy. Morality for the moment.
Wow, tell us how you really feel. Are you also going to confess what you were doing right before this episode started recording with your BMI and the Livongo diabetes prevention?
I was finding out how much weight I had to put on to qualify to get into the study so I could lose weight. So I either have to put on about 15 pounds or I have to get about 2 inches shorter. Either one could happen.
We took an exhaustive look at the website for BMI, where Matthew made himself an inch taller, a couple years older, a couple pounds lighter, a couple pounds heavier, a couple of
They don't care how old you are. But the answer is that the non-PPP study. This is not about how much money did Livongo and Amada get. It was about the DPP, Diabetes Prevention Program, which is basically a diet with coaching. And Livongo bought a company called Retrofit. Amada started off doing that. And the boast, I think, today is that Livongo in their study found that people at year 1 lost more weight than the Amada people. It's not entirely clear who they were. There's a whole bunch of selection stuff. I'm sure the Amada people will tell us why their thing was just as good. But what it tells you, for those of you who are trying to lose weight, who do not include you, Jessica, probably do include me, you need to log your food. If you log your food and figure out what you're actually eating, that's the most effective way to lose weight. And what they were trying to do is figure out how much coaching, prodding, pushing, blaming, shouting, whatever it is, was going to get you to lose weight. So it was actually quite effective. Even the people who didn't really go through the program lost like 3% of body weight. And they were, they had BMIs of 33 plus. So in other words, my BMI is around 30. If I put on 20 pounds, it'd be like 33. So kind of where I would be starting if I wanted to get in the average of the program. And those were the people who lost, they lost like, relatively small percentage of their body, but they lost like 3-4%, which is actually quite a lot of pounds if you're over 250, 15 pounds plus, whatever. So the upshot is, these programs kind of work if you take part in them. So just taking part is probably a good start. And if you do them religiously, some of those people lost more than 10% of their body weight. 25% of the people who did it kind of really were engaged, lost more than 10% of their body weight, which would probably make me look, better.
You can't look any better than you do, buddy. You've got that winning smile whenever we see it.
Yeah, you're so nice. That's not what you were saying earlier before we started the show.
Well, because you're harassing me to hurry up, while meanwhile you're like, oh, let's see if I make myself an inch taller. What would my BMI be then? I had to sit through that rabbit hole.
All right.
So on Twitter today. Can't wait to find out. If you can't wait to find out either, you should follow the guy at Bolty Boy for all of the excitement. Who did you call yesterday? Bank of America and Chase? What are you doing today for your next trick? Wells Fargo? Can't wait to see how that goes. And if you do follow along for that, be sure to follow me at Jess DeMassa and DM me your bets about how high his blood pressure is going to be right around minute 15 when he's waiting on hold. I'm going to be collecting that information. We'll be awarding winners on the next episode of Health in 2.0. Oh, to make sure you don't miss that episode or any others, please sign up for our email newsletter on thehealthcareblog.com. All of the Health in 2.0's appear there, as well as a bunch of beautifully curated content from the blog for the week. We'll talk to you guys soon. You look stunned.